Hi, I'm Major Tom Smith, Chief of the Emergency Department at Evans Army Community Hospital at Fort Carson.
Hi, I'm Major Tori Salas, Chief Nurse of Primary Care at Evans Army Community Hospital at Fort Carson.
Let's start with what we know so far. Many of you have questions about COVID-19 and have seen conflicting information online about what to do in different situations. We hope this guidance from the Centers for Disease Control and Prevention and the Army Public Health Center will empower you going forward.
You can help reduce the risk of infection by avoiding close contact with people who are sick and also staying at home when you're sick. Be sure to cover your coughs and sneezes with a tissue and then throw it away. Remember, wash your hands often with soap and water for at least 20 seconds. Follow a balanced diet with exercise and remain current on vaccinations. Also, keep your frequently touched surfaces clean and disinfected daily.
The CDC does not recommend wearing a face mask except for those with COVID-19 symptoms. However, healthcare workers and people who take care of patients in close settings, at home or in a healthcare facility who have COVID-19 symptoms should wear them. We need to ensure there's enough supply for those providing care to those receiving treatment. COVID-19 symptoms include fever, cough, and shortness of breath. These are similar to symptoms shared by other types of influenza and the common cold. The other factor to consider is whether you have recently traveled from an area with ongoing, widespread COVID-19, or if you have been in close contact with a person known to have COVID-19.
Before arriving for treatment at any healthcare facility, please call ahead. This will ensure the appropriate precautions can be taken to protect our patients, staff, and the community. We recommend calling the MHS Nurse Advice Line 24/7 or the Fort Carson Public Health COVID-19 hotline if you have symptoms and have been exposed. If you don't have symptoms and you haven't been exposed in a situation of likely exposure, you do not need to be tested.
When you arrive at your healthcare clinic, you will receive care based on your symptoms. If your symptoms match those of COVID-19, which include fever over 100.4 degrees Fahrenheit, cough, and shortness of breath, you will receive COVID-19 specific care based on travel history, contact with confirmed COVID-19 cases, or a case-by-case health risk assessment. If you do not meet the criteria for COVID-19 treatment or tracking, you will receive care appropriate for your condition. If you meet the criteria, you will begin the following process. If you are well, you will begin a 14-day period of restricted movement or quarantine. This period is designed to protect you and those around you by monitoring your health and allowing fast treatment should you develop COVID-19 symptoms. If you reach day 15 without developing symptoms, you will be released from quarantine. If you seek care with COVID-19 symptoms or you develop symptoms while in quarantine, you will receive laboratory testing. Testing begins with a rapid flu test. Children aged 10 and under also will receive a RSV test. Test results return in up to 2 hours and will confirm whether you have a different illness similar to COVID-19. If you do not have a different illness, you will have samples submitted for COVID-19 testing. Currently, the turnaround time for testing is 48 to 72 hours, but depends on backlog at the state laboratory. While you wait for your test results, you will be placed into isolation. Upon return of your lab results, you either will be released from isolation or continue in that status until your symptoms cease and you are released from isolation. Throughout your period of isolation, you will receive medical care as is appropriate for the severity of your symptoms.
Visit the CDC website for the latest information on COVID-19. Their team of experts are working around the clock to make sure the country stays informed and protected. For local updates, visit Evans Army Community Hospital on social media or visit our website. Help keep your community healthy by only sharing accurate information. Thank you, Care with Honor.